Are you pregnant with a terrible cough and cold and you're trying to figure out what's safe to take that's an over-the-counter therapy versus not safe to take in pregnancy? Well, I'm a pharmacist and I can tell you in general what are the safe medications to take and what are the not safe medications to take. So 2 disclaimers. Number 1, everyone watching this video is an individual and should talk to their doctor to know what medications are generally safe for them and what are not. However, this information that I'm giving you is for most pregnant women safe. Disclosure number 2 is in pregnancy, I generally go with if you cannot take the medicine, best. But if you need the medicine, at least I'll give you the ones that we generally recommend as safe in pregnancy. So let's start with a fever. If you have a fever, chills, aches, you feel awful, yucky, acetaminophen or Tylenol is safe to take in pregnancy. The ones you do not want to take are the ibuprofen and naproxen. That's your Aleve, your Advil, your Motrin. Do not take those. So if you have fever, chills, body aches, acetaminophen. If you have those more like seasonal allergies, watery eyes, runny nose, sneezing, you can take antihistamines like Claritin, which is loratadine, or Zyrtec, which is cetirizine. Those work really well for those seasonal allergy type colds. You can also use nasal corticosteroids. There are some that are safer than others. Budesonide is the number 1 recommended pregnancy nasal steroids. So that's your Rhinocort. The next one is Flonase or fluticasone. That's a good one too. The one you do not want to take is triamcinolone. That's your Nasacort. So if you're going to take a nasal steroid, it's either Flonase or Rhinocort. That would be for your seasonal allergies. Now, if you have a stuffy nose, you have congestion and you can't breathe out of your nose, the worst thing in pregnancy is when you have a stuffy nose and there's not much you can do for it. So you do not want to take an oral decongestant. That's your Sudafed or pseudoephedrine, or your Sudafed PE, which is phenylephrine. And neither one of those are recommended in pregnancy. However, you can use those nasal steroids, like I just said, the budesonide, Rhinocort, and the Flonase. Those are safe in pregnancy, and they help with both stuffy nose and the watery eye, sneezy symptoms. So you kind of cover both with that one type of medication. The other thing you do not want to use in pregnancy is Afrin. That's that 3-day nasal spray that opens up your passages really well. Not safe in pregnancy, so don't do that. The number 1 recommendation for pregnancy with stuffy nose is just a nasal rinse or a nasal a saline spray. You just spray it up your nose. They're actually pretty effective. So if you can do the nasal spray or the nasal rinse over a medication, that's always the best option. Last but not least is a cough. If you have a horrible cough, I get it, when you're pregnant, you've got that big belly. It's hard to have that big, deep cough. So if you have a cough and you're trying to get rid of it, cough drops are recommended. I try to go with the menthol free, so just the sugar cough drops if you can. That way you're getting a little bit less medication. The whole point of a cough drop is to just coat your throat. So you can do that with a cough drop, you can do that with honey, you can do that with lemon water. You can use dextromethorphan, which is Robitussin. That's the over-the-counter cough syrup. My only issue with that is Robitussin is not the most effective cough syrup ever. So you're taking a medication, putting it in your body that is not even that effective. So for me, if you're going to put a medication in the body, it better be working. So those are your recommended medications in pregnancy, the ones that are considered safe versus the ones that are considered not safe. So if you're looking back at this video, you can write down, these are the safe ones, these are the unsafe ones, and now you know which ones you can take, and hopefully you feel better, not only symptom-wise, but also knowing that you're doing the right thing for your baby.